Absolutely. So my name is Sarah Cassidy, and I own Initiating Lactation in Olympia, Washington. My background is that I started out as a massage therapist many years ago. And when I had my children, my first child about 13 years ago, I saw a huge gap in care as a family that had a natural delivery but chose the hospital. Ended up with a huge gap in care and watched friends really struggle with their transition into parenting and especially with breastfeeding. And I was fortunate enough to have a midwife as a cousin and a mom who was a Lactation League leader. So it inspired me to start this journey toward becoming a lactation consultant. 13 years later, here I am. I've become a nurse and become an internationally board certified lactation consultant, and have just gathered up lots of wonderful experiences from not only hospital settings, higher risk hospitals, some higher level care in the Tacoma area, and worked with a lot of wonderful professionals around the United States and around the world that have given me the experiences to provide postpartum support and really help prepare families for breastfeeding, as well as guide them through. And whether it's me that's giving them the resource or connecting with them with resources during that part of their parenting, it's really just a beautiful way to be able to intersect with families in a way that I wish that I had experienced when I was first having my children. And so I work with a group of midwives in Olympia, Washington, and I do both in-person and virtual lactation consultations, as well as right now with COVID, everything is online with my classes. So I do pre-recorded complimentary breastfeeding and pumping classes at this point. I have offered them in person, and I foresee offering them in Zoom so that we can build some more community. And I also sit on the South Sound Breastfeeding Network, which has been around for 20 years in the Olympia area. And we've traditionally offered not only family events, World Breastfeeding Weeks, complimentary photo shoots, and movies like The Milky Way, but we also provide resources for our region with a resource guide and a website, and education for professionals. So I feel really grateful to be able to be sharing this information with you, and hopefully answer some questions for families that are heading into their parenting journey and breastfeeding.
That's a really wonderful intro. And I will be, so as you guys are watching this interview, I'll include all of Sarah's contact information in your materials so that you can reach out. If you want to do some of those online consultations or take any of her courses, you'll be able to follow up with her. So I guess maybe we could start with a few basic questions. I know I've had 3 children, but as a first-time mom, I think the idea of breastfeeding was very foreign to me. I think that's one of the strange things for American women is our culture isn't as open about breastfeeding as some cultures are, and so you don't see it a lot, as often, and so it kind of feels scary and a little bit. You've heard that it hurts, or you heard that it's hard. And so maybe we could just start with, I'd love to talk about breastfeeding and a reason to consider it if you've never considered it. And then maybe we could talk after that about what does a lactation consultant do? Why would you want one or need one? And then maybe some common challenges that women have with breastfeeding that they might be able to prepare for or be excited about either.
For sure. Absolutely.
So why would someone want, like, if you've been like, nah, I'm not going to do it, why would you encourage a woman to consider breastfeeding if she can?
So breastfeeding is definitely a really personal decision. It's sharing the space of our body that we've already shared space for the last 9 months. And so I think that it's really important to consider where the family is at emotionally with that, whatever it is that we bring into it. And so I always like to talk about that and really honor the gestating and lactating parent and know that it is sharing space. So with that said, the reasons everybody talks about reasons to breastfeed babies because of the reasons that are good for babies, I like to talk about it in terms of the lactating parent. So the number one killer of women in the United States is heart disease. And breastfeeding alone decreases your risk of heart disease by 5-fold.
Wow. I
There's
had no
nothing
idea.
else in the whole world that will decrease your risk of heart disease like breastfeeding. And anyone that's ever expressed milk or seen raw milk, whether it's human or cow or otherwise, you'll notice that when you put it in the refrigerator and you have a container of it, that the fat rises to the top and there's kind of a little layer of fat. It's the only time that we can remove fat from our bloodstream. So even like
Wow.
statins and things like that that are designed to help decrease that later in life, breastfeeding really does do that, just that. It's 20 calories per ounce of removal, so about 500 calories per day with breastfeeding. And it decreases the risk of heart disease. Hugely decreases the risk of cancers by like 30%. Breast and ovarian cancer, increases bone density, and it also helps with postpartum mood disorders. So that bonding, that surge in oxytocin is really helpful, especially during these times when we're a little bit separated. Maybe we all are a little bit triggered and anxious. And then I'll segue this right into why it's good for baby. It is the only vaccine for COVID that we have currently.
Wow.
Breast milk carries antibodies. And there are multiple studies currently happening, Harvard and Stanford, University of Washington, that are all looking at breast milk and coronavirus. And we've known for as long as we've been studying breast milk that we pass our immune system through our breast milk. And it is a way that we can actually protect our babies from COVID. So if we've been exposed and we're a carrier of antibodies, we're actually able to pass those along to our baby in a way that nobody else is getting that kind of passive immunity.
Wow, that's amazing.
It's incredible. Yeah.
I heard about the immune system thing, but I didn't realize that it was so specific even.
It is very specific. So anything, and that's part of why it's really helpful to stay near your baby during that first 3 or 4 months, because anything you're exposed to, your immune system can be triggered then and then pass immediately as medicine through your milk, even if your baby wasn't exposed to that particular microbe.
Mm-hmm.
So, and I love that you talked about that all or nothing idea, because, you know, I'm a working mom, and now I'm working and I have older children. But when I was nursing and when I was parenting babies, I worked outside the home. And one of the jobs I had was I worked night shift as a labor and delivery nurse and was pumping. And that idea of all or nothing with breastfeeding can become really powerful. And I hear it a lot from families. And one of the things that I like to talk about is that there are I see them as 3 really big reasons for breastfeeding. One is the nutrition that I think we all think about. The other is the medicine that's in our milk. And so we have in 1 teaspoon of our breast milk over 3 million antimicrobials. And then there's also the bonding. And so even if there's a very small amount of milk, or it's just not feasible, maybe the work that the person is doing outside the home is just not conducive to pumping and bringing milk home. I've worked with some families that are working in hospitals right now, and they're just not comfortable bringing that milk back into the house, which, by the way, is safe. There's lots of great information out there about that. But the reality is that it's not all or nothing. Even a teaspoon a day is stronger than any medicine that your baby could get in any of the best hospitals in the world.
And that's got to be such relief for women. If you're listening to this before you have a baby, I can tell you what's going to happen is there's this intense, no matter which way you feed your baby, breast or formula, you feel worried and you want, you wrap a lot of feelings and guilt around it. And so I love that you said that it's not all or nothing. It doesn't have to be, I just can really relate to that, because with my oldest, I was full-time active duty and I was pumping, and I did feel very much all or nothing. It was my first. I was like, I was breastfeeding and I thought I can't give him any formula. And I don't know why I thought that. But it was just stuck in my head, and it caused me an intense amount of stress that he wasn't getting enough, that I didn't have enough to send to daycare, that he would run out. And then if he did, we didn't have, it was just, it didn't have to be like that. It could have been a little bit of supplement. It could have been, but I just didn't have that information.
Yeah, absolutely. I think that just knowing that in your heart that, a breast that makes milk can make more milk, and connecting with someone that can help if that's something that you're desiring, but not to, carry that weight. I think that sometimes there's this weight about the way things have to look. And even in the very beginning, in those first days, sometimes it can take a week or two to kind of listen to what's happening with the natural instincts with babies. It's part of why lactation consultants recommend not using pacifiers, so that we can watch what's happening with their mouth and see their feeding cues. And so it can be helpful to really learn how to do that dance with your baby that first week or two. And it can be a little challenging. They're not things that, there's no manual for this. Our breasts don't come with a manual. And so that's why it's so important to attend a breastfeeding class if you're planning to breastfeed. I know that childbirth education gets a lot of attendance. And as a former labor and delivery nurse, I can say, we can have really great laid plans when it comes to labor. And it's like a wedding. You plan and plan, and then you blink and it's over. And the people that are around you will support you with that. And it's helpful to have that information. The part that is really I like to use the analogy of like the wedding versus the marriage. A lot of people put all their energy into planning their wedding, and they don't ever do any kind of premarital counseling or even talking about important big topics. And it's the same thing with childbirth classes and breastfeeding classes. The childbirth piece, the labor and the delivery is over pretty quickly. And it's a piece of your life that happens in a day, hopefully, sometimes a couple days, depending on someone's experience. But it's the breastfeeding. And American Academy of Pediatrics recommends a year of breastfeeding with complementary foods added at 6 months. And World Health Organization recommends at least 2 years. Again, complementary foods added at 6 months or longer if it's still working for the family. And both of those organizations recommend the same. And that is a long relationship, like a marriage between you and your little person. So doing a little bit of planning so that first week or two is not so uncharted. I think that that's really the best way to think of it. Like, you wouldn't set sail on an ocean without a map. And so taking a breastfeeding class and learning about how your baby works, because they're born with natural and instinctive reflexes to latch, and how your body works, which is not like a bottle. It's very different. It's unique, and it's predictable. I always think this isn't rocket science, what I do for my living, but it is kind of like being a midwife. I mean, I guide people through a hard time in their life. For some people, it's much easier. For others, there's some hurdles. And so being able to walk beside them, it's like crossing a mountain, and just having someone that knows what all of those paths are can be very helpful. So take a class and identify who are the professionals in your area. Does your hospital have inpatient and outpatient lactation services? Ask your friends who offers lactation consultation in your area, and make sure you have that phone number jotted down, because it's probably going to save you in the middle of the night if something is going in a direction that you're curious about. You can always reach out and ask some questions then.
So maybe let's talk a little bit, just without going super deep, maybe we could talk about what happens when your body's going from pregnancy to now the baby's here and you're producing milk. What's to be expected?
Absolutely. So the thing that surprises most people is that we start making milk at about 20 weeks. So if you're pregnant and you're listening to this, you are likely already making milk. And the beauty in that is that it's not that your milk comes in, it's that it transitions from what it is at starting at 20 weeks until you're about 4 days postpartum. And it's actually your hormones that trigger a change in that milk. And so that first 4 days are an opportunity to learn how to latch. So practicing positioning, practicing latching deeply. I have a lot of families that talk about like they're bringing the baby straight on. So I watch them latch the baby and it's like tab A fits into slot B. It doesn't work like that. And so the thing to keep in mind is that we latch babies with the nipple pointed way up, and we latch the lower lip to the bottom edge of the areola, and then the nipple goes much further in the mouth, and they can get a lot more milk. And then the nipple is way back in their mouth and not being pinched. So I have lots of really good videos and can certainly explain that in my classes. But that's the most important thing. And I think that most families are working on that first couple of days more than anything.
Because the
like
baby's not really eating a ton of milk that first
They're not.
day.
No, they're getting very small amounts. Their tummies are tiny. When they're first born, they're little tiny tummies, and they grow incrementally over time. But the idea with that is that it gives us a chance to practice. I think it's nature's grace, so that we can practice a little bit, but pretty often. They need to eat about every 2 hours at least. And just practicing moving that very thick kind of honey consistency milk.
I remember being surprised the first few times that I nursed, that I didn't expect this to happen. A few things. One, that my uterus contracted. It felt like someone punched me in the stomach, and I was not prepared.
Absolutely. Well, and that's one of those, remember we were talking about like, what are the benefits for you as a breastfeeding mom? And it's that it decreases your risk of having excess bleeding because your uterus actually contracts down every time you breastfeed. The thing that I think is really cool to think about is that in your breast, you have lots of little mini uteri, little tiny uteri muscles wrapped around all of the milk, all of the little storage sacs called alveoli, where the milk is made and stored. And when your oxytocin gets high, just like in labor, oxytocin gets high and your uterus contracts. When you're nursing, your oxytocin gets high, your uterus still contracts, which is why you feel those cramps. But when letdown happens. That surge of oxytocin squeezes all of those little muscles and shoots the milk out. And I'm sure that, if you've breastfed before, you know what I'm talking about, that kind of tingle and that spray of milk. That's actually because of that surge of the love hormone, oxytocin. And it can cause that cramping in the beginning. It's actually a really good sign that you're latching well to have that cramping, and your baby's doing you a favor.
The other thing that surprised me in those first few days, where I thought that my breasts were big. At day 2, I was like, oh, the milk's in. And I remember my doula saying, no, it's not. And then 2 days later, it was next level. And I was surprised.
Absolutely. When milk transitions like that, it's not only is it milk, but there's a lot of swelling that happens because the blood supply increases really dramatically. And so there's some swelling in the breasts. And so the best thing to do, and I would say, again, this is one of the reasons that I do this work, is that by day 4, I would say 90% of us that deliver in a hospital setting are completely cut loose, and we aren't going to see our OB until 6 weeks. And so it's really surprising. And we're kind of left in the middle of the parenting forest without a roadmap through, with giant breasts, and sometimes hard to latch the baby to a little bit more swollen breast tissue.
And so babies have the natural urge to latch, but it doesn't mean they're going to know how to do it, right? Like there are some techniques that might.
There are a lot of techniques that can be helpful. The thing that is helpful for engorgement, and I think that this is something helpful to put in the back of your mind, whether it's for you or for a friend, is that a warm soak in a bathtub or take a shower can be really helpful, and gentle massage, very gentle massage down, nurse the baby, and if the baby won't nurse, you can certainly pump that milk forward so that you have the milk expressed for breast health. And
Mm-hmm.
then cool compresses, or even, I don't know if you've heard of this one, but cool green cabbage leaves are really helpful to take down swelling.
I
And
have heard
really
that, but I
comforting.
never tried it.
Yeah, it works really well. So that's something that's helpful with engorgement. Sometimes babies won't latch because that nipple that was sticking out really far, all of a sudden it's pulled way back because this whole area is swollen.
Oh.
Some women don't start with very sticky outy nipples. Theirs are either really short or they're really flat. And I think it's helpful to remember that babies don't nurse the nipple, they nurse the breast. And so remember we talked about latching at the bottom edge of the areola. So if you have really flat nipples, you're still aiming for the bottom edge of the areola and coming around.
Mm-hmm.
You can extend the breast tissue by making a sandwich. All right.
Mm-hmm.
So whatever the orientation is with your baby, you're compressing the breast tissue. And especially during engorgement, it's helpful. Otherwise, it's like trying to hold onto a flat wall. Yeah.
Mm-hmm. Yeah. And I think that might be something that new moms might not realize. They think that the baby's just supposed to be on the front of the nipple as opposed to really getting onto the whole breast.
Yeah.
And how do you know this was one of the things that I think a lot of moms struggle with, is you're afraid that maybe the baby's not getting enough. How do you know that you're actually doing it correctly?
That is such a great question. So that one of the best ways to know that your baby is getting enough milk is that you're tracking diapers that first week, and what goes in must come out. So for each day of your baby's life, they should have the same number of wet and the same number of dirty diapers. So day 1, they should have 1 wet and 1 dirty. Day 2, 2 wet, 2 dirty. Day 3, 3 wet, 3 dirty. And then remember I talked about day 4, things transition. So at least 4 wet and 4 dirty, day 4, and then you'll see a big upswing. And they'll move within that first 5 or 6 days up to 6 to 8 very wet diapers and 3 to 4 dirty diapers. For most babies, it's much more than that when you get into that second week. But if it's less than that, or you see little orange or red like splashes that almost look like brick dust in their diaper, those are some clues that it's time to reach out to either your pediatrician, your birth provider, your midwife, a lactation consultant, because your baby might need a little bit more milk. Weight is also part of what we look at too. Oh, sorry. Go ahead.
No, okay. Are those like little red dust clues of dehydration? What is that telling you?
Yeah, those are clues of dehydration for sure. So the urine should be nice and clear and not concentrated, and no little orange or red splashes in the diaper. Those are kind of like the warning signs to, get help. Let's look at how much milk the baby is really transferring. And so when we're talking about a baby that's drinking well, this is a baby that's waking up about every 2 to 3 hours. They latch onto the nipple, and babies suck fast, like knocking at the door. Come down, milk. Oh, come down. And then they do this thing where they drop their jaw really low. Okay, so you'll see it drop from the side. Sometimes you'll see their ear wiggle. And their jaw will drop really distinctively. And sometimes you'll hear a little sound like a or it's back of the throat, little soft noise. And that's a swallow. And so noticing if babies are they asleep or are they swallowing, and then counting diapers. Those are really the best ways to know that babies are getting enough in that first couple of days. And then we do track weight. So babies are born and they get weighed pretty quickly, and they all lose a little bit of their birth weight. Even babies that are fed bottles immediately right after birth, they all lose a little bit of weight. So I think it's reassuring when you go back in to know that about 7% is what is on the average. Okay, if babies, they lose all of that meconium that they're born with, that thick black stool, and they're born a little waterlogged from all of that amniotic fluid. So some of that evaporates off. And if you get a lot of IV fluids or you have a cesarean delivery, it can be on the higher end. Sometimes even 7 to 10% of their birth weight can be lost. Oh, wow. And again, as long as they're eating well, plenty of wet and dirty diapers, we're not having jaundice issues or painful nipples, that can sometimes be a little bit more in the normal range. But working with your pediatrician, you'll see your baby come all the way back to birth weight by 2 weeks and then gain about an ounce a day. And that's how we know babies are getting enough, because we can't watch it go in.
Right. Yeah.
Yeah. And so that is, yeah. And so I like to really, I like to say, just like looking inside with an ultrasound gives you kind of that reassurance and peace of mind while you're pregnant. And then you go home and there's a whole lot of like, whatever your belief system is, like you just be, you eat the best food that you can, you take good care of yourself, and you just be. And there's a certain amount of faith, or whatever it is that you want to call it, in trusting the process. Okay?
Do you have a recommendation for new moms when they're maybe that they want to breastfeed, they know they may supplement with formula, they also maybe, there's probably a million different combinations of what families might choose to do, but say they also know that they want their partner to help with bottle feeding at some point. What do you recommend for those first few weeks in regards to like establishing breastfeeding?
I love that question, because I commonly hear, my plan is to combination feed. I want my baby to bottle feed. And especially like the second half of that sentence is when I'm back at work, or when they're 4 months old and I have this plan to go on a little vacation. But the reality is that if your plan is to be able to breastfeed and have breast milk be the primary nutrient in their diet, it's a really good idea to establish that first. And it takes about 2 weeks to establish it well and feel like you've worked out all of the latching and positioning techniques, your milk has transitioned in. And remember when I said, it's small amounts at first, and then it's like a deluge of lots and lots of milk, and then it has to kind of balance out supply and demand. And that can take a little bit of time. You've got to get through that. At about 4 weeks, I recommend families that are planning to bottle feed to circle the baby's 4th week of birth. And that's the time that they could start practicing with a very slow flowing bottle, 2 or 3 times a week. And they would pump during those same times. So pump for 10 minutes and then offer about 2 ounces of their pumped milk. If they wanted to start building a freezer stash, and I watch Pinterest and I watch all of the people showcasing these huge amounts of milk in their freezer, and I just my heart goes out to them, because I worry about their health, for the reason that it's really not such a healthy thing to be pumping early on when our cups runneth over, quite literally, the cups of our bra are filled with milk. Let it be, let it settle during that time. And then at 4 weeks, that's when to start building a little bit of freezer supply at a time. It's like a savings.
Better, because I was always jealous that, wow, look at that freezer supply.
Yes, people have tons of milk out there. I do tend to see some of those families back with chronic oversupply, because if you're removing enough milk for 3 babies, you're going to make enough milk for 3 babies for a while. So the first 4 weeks, just take out enough milk for 1 baby, and preferably at the breast, so that you can really learn that and then add other things in.
I feel like 4 weeks a lot of women think they're supposed to start pumping if they have to go back to work. So they think, okay, well, I've got to start stockpiling to go back to work. But I like what you said, your body's sort of adjusting to the needs of the baby, and those needs, because you're at work, you're essentially just replacing the feed with a pump at similar times. And so you don't have to worry. You'll have essentially the, similar supply. And I think there is a learning curve with the pump too. Not all women feel as successful with a pump. I know I struggled for a little while.
And I'll give you my little insider tip. I discovered a new pump that's amazing. It's the Unimom Minuet. And it's like this big. It's the size of a hockey puck. And it's completely battery operated. And I've worked with hospital grade pumps for a long time, and it's as powerful, in my opinion. I've hooked up all of my pressure gauge to it, and it has I want to say 7 massage modes. So instead of like the Medela where it's like
Mhm.
either fast or it's slow and
Wow.
that's all you get. There's 7 massage modes to get you to have a letdown and 9 expression modes.
Wow.
It's interchangeable with all of the spectra parts as well, which is kind of helpful. Same tubing, same kinds of equipment.
Which pump is it again?
It's called a Unimom Minuet.
Okay, well, we'll put the link for it
It's
because
really
everyone
fabulous.
always asks. I know I got the same one that I got 10 years ago,
Yeah,
but the newer model of, the double, I think it's a Medela, and it's fine. It was fine.
absolutely.
Going back to work after I had my oldest was when I was active duty, and I remember pumping in a closet. They didn't really have a breastfeeding. That's a whole separate topic, but they didn't have a real great place to breastfeed. But so they made me a closet, and I would go in there and I'd have those double things hooked up and
Oh
watch
yeah.
watch my phone. And then it was always a situation to go and feel like you could wash your hands and have the bottles refrigerated and all this thing to, I mean, it is a commitment.
There's some pieces to that. And I have a class called Making Peace with Pumping uh,
Hmm.
that has a lot of hacks. And certainly there are even more out there. I mean, between YouTube and Pinterest and all of there are some really cool websites and blogs and things like that. I pumped for both of my kids. It's been a minute since I pumped, but I'm pretty plugged in with what's going on. And the one hack that I would say is you don't have to wash all your parts between every pumping session. So
Mm.
if the reusable, like the wet dry bags, like you would use for cloth diapering,
Yep.
work great to just, pour all of the milk into one storage container and then put your still a little milky, but there's no actual volume of milk back in that bag, and you can put the whole thing in the fridge and pump right into it.
Oh, wow. No, that's a
That
really
saved me so much, and it really it's very helpful if you're doing a lot of, especially exclusive pumpers, or um, it's just not enough time. It can be really helpful.
yeah. Sorry for the background noise. My kids are helping
So
themselves to water despite being told.
aren't we all? I mean, it's that time. We're all doing a lot of things as parents. So
Yes, they're here. So I another question about, I guess I wanted to hit on is, if you go to a breastfeeding class before you have your baby,
mhm.
you might meet a lactation consultant. Do you recommend that someone would set in a relationship up with someone before they have a baby, or is this something that you essentially meet someone immediately postpartum? I know my hospital offered a consult, but when you were talking about those first couple of weeks and having someone to call, how do you set up a relationship like that? And is that like someone who would come to your house and help you latch? Or I know it's different with COVID, but how does that work?
So I think it's unique depending on the region that you're in.
Hmm.
We're fortunate enough in Washington State, where we're both located, that we have a lot of resources, and so um, a lot of hospitals still have consults happening that are in the hospital that are outpatient. There are not that many people that are doing in-home visits right now. It's what, mid-August, and we're in the chapter that we're in right now. I'm currently not doing home visits, with the exception of a few back porch visits. I think I've done 4 on
Hmm.
patios, but we have nice weather right now, and so that's an option. A lot of us are doing clinic visits, and so just having the name of someone in your region who is available to do an in-person assessment of latch in case something feels like it's out of what normal looks like. And that hopefully the breastfeeding class teaches what normal looks like. That's what my class focuses on, so that if it starts to stray from that, then you reach out and you let someone else assess it.
Hmm.
And so I would say, do you need to schedule an appointment during the prenatal period? Probably not. There are a few people that should, though. If you have inverted nipples or flat nipples, remember we talked about, like, does your nipple stick out far, or is it really, really short, or is it inverted and there's actually a little fissure, like a little inverted belly button? If it's flat or inverted, it's probably a good idea to chat with someone before you deliver and establish some relationship.
Hmm.
I also have a class that's specifically about preparing to breastfeed with inverted nipples. And so if that's your situation, please reach out to me. And I have a class, it's a 30-minute online free class that I teach on that.
Mm-hmm.
The other person that should definitely reach out is someone that has had a breast reduction, or if they have like an underlying hormone disorder. So anything like insulin-dependent gestational diabetes,
Mm-hmm.
polycystic ovarian syndrome. There are some endocrine disorders like that that can interfere a little bit with breastfeeding. And so just having a plan pre-established, oftentimes in cases like that, there's really good evidence around doing some early hand expression of milk, starting at 37 weeks. You don't want to do sooner than that because you can start a little bit of preterm labor. But it can be helpful to, just like if someone is going into surgery and they'll have you bank your own blood for
Yep.
your own surgery, the same is true with your breast milk. Remember I said we start making it at 20 weeks. So if you're at a higher risk for needing to early supplement, especially those with diabetes who have higher blood sugars, babies are used to that.
Mm-hmm.
And when they deliver, they need a little extra calorie intake. Having some saved up breast milk can be helpful. And so I would recommend working with a lactation consultant in that case, and just having the relationship there. But most people won't need to have a prenatal visit. Just having some really good education around what normal looks like, and having at least 1 or 2 phone numbers. Who's in your area? What does your hospital offer? So it's really about asking questions. And most of the birth providers that you work with should have that. But you can also get online and look at the Breastfeeding Coalition of Washington. And there are lots of resources there if you live in Washington State. Or you can look at, there are a couple of links that I can give you for national resources to find a lactation consultant.
I'd love to include those. And I think in addition to, so another reason I could think of a woman wanting to maybe reach out to a lactation consultant, and correct me if I'm wrong, but the latch is one piece that could be challenging, but supply, I feel like, is another thing that comes up a lot, where a couple of weeks in, moms are like, well, I'm just not making enough. How do I increase my supply? Do I need to eat something different? Should I be drinking beer? Like, do I need lactation cookies? Do I need to start supplementing? This supply question.
Absolutely. So supply, especially because we can't see it going in, it is so hard to know. The gold standard, though, is your baby gaining an ounce a day? And are they gaining on their own percentile curve? And if the answer is yes, then you let go of that fear around supply. If the answer is not yes, then working with a lactation consultant to look at what is happening. And that's where I always say that the work that I do and my friends that are lactation consultants do, we're like Sherlock Holmes, we're like detectives. And we ask all about the birth and all about your breasts. And we look at your breasts and your baby and inspect their baby's mouth. And we watch you nurse and we weigh the feeding. So we weigh feedings to see how much milk is transferred during that session. But the thing I like to say about that is that weighing one feeding is like trying to estimate a whole forest by counting a single tree. So it really is overall what their weight gain is that gives us more information about that. But to answer your question,
would help with that piece.
Yeah, it does. It helps a lot with that piece. Oftentimes it's really reassuring. And more than anything, it is a tool to empower the family to recognize a good feeding and baby swallowing and being alert and what their breasts feel like before and after the feeding, instead of being a tool that we're just looking at the number. I like it to really be something tangible that lines up with what they're already learning about their baby and learning about their body. So it can be helpful in that regard.
Yeah, that's great. I think that just knowing that there's someone that could help you with that, you don't have to stress on your own. There are people who have made this their, there's your little one.
See, you're not alone in little people running around. You want to say hello, Liam?
Hi.
Okay. Can you ask your sister for help, please?
It's perfect.
Hold on, I
And
bet
almost every interview, we've had little people on
Oh, they're so cute. Okay, go.
on the interview.
Oh, come back. Come back. He needs help buttoning his pants.
Oh, you take your time. You are good.
All right, buddy. Good job.
Aw. Well, maybe I'll think of just one last question. I know I want to be respectful of your time. I think we've covered a lot of really good things. If you, and this is, maybe it's too broad. If you were going to give some advice to women, particularly who want to breastfeed, who know that they want to at least breastfeed either exclusively or in addition to using formula, what would that advice be?
Oh gosh,
Wow.
it would be take a breastfeeding class.
Take a breastfeeding class.
Take a breastfeeding class. I can't say that enough. When I worked in the hospital and I would help deliver babies, I would always ask, "Did you take a breastfeeding class?" That was just part of my assessment, and I would say that 90% of people did not. And it's such a simple step. We think about how much time we watch, I don't know, TikTok video or Netflix or, whatever it happens to be. And feeding your baby is such an important piece, and it will save you so much heartache and headache. Take the time to really just watch the class, ask the questions, and be connected with people that can help you in your hour of need, because you're not alone. And we've all walked this path, and we're at different places in our lives. And I just feel really fortunate enough to have been called to do this work so that I can be there and help people when they are in their moment of need. And if I'm not the right person, if it's something else that you're after, then I can certainly, connect you with that. But I think that just knowing who your circle is and building that.
I think that's such great advice. And, women, we put a lot of pressure on ourselves. We feel like we should be able to do a lot of things, and we put that word should, and we have expectations of things going certain ways, and motherhood and labor and pregnancy and delivery and newborns and all of that. We thrive with a support system, and breastfeeding is no different. You having some support can make it less stressful, can make it more doable. You can practice and learn and learn with your baby. And I think that that's great advice. And I'll tell you, if I hadn't accidentally gone to the breastfeeding class before my first, I don't know if I would have been very successful. I was actually trying to kill some time because I was, 39 weeks, and I was like, I'm ready. And I needed something to do. And they were like, there was this class, I was still in the Navy, and they were like, well, you could do the breastfeeding class. It's Tuesday night. And I was like, fine, whatever. It'll give me something to do. But if I learned a technique that literally is how I breastfed all three of my babies. And if I hadn't learned it, I don't know, I would have struggled probably. It was very helpful.
Absolutely.
Well, thank you so much. I'm definitely going to include all of your resources. Is there anything that we didn't cover before we wrap up that you would want to share?
Well, not that I can think of. I mean,
we kind of didn't go down the rabbit holes of problems that women might run into, like mastitis and those kind of things. But are there any, I guess maybe things that are not normal that you're like, if you're seeing this, then go ahead and call your doctor. This is not a normal part of breastfeeding.
Well, one of the things that I always like to point out is that, especially during this time of COVID, that if you are breastfeeding and you get fever and chills, don't automatically think that you're sick with the virus, because it is likely mastitis. And so take a pause and inspect your breasts. And so a fever and chills and a red firm spot in your breast is more likely a breast infection. And so I always like to kind of plant that little seed, because we just live in an unusual time right now. And that happens to be a symptom that a lot of people are watching for already. I always like to say that nipple pain is not normal. It is lights on the dashboard. So we talked about the orange or the red crystals in the diaper for babies. That's like the alert that the babies will send about dehydration.
Mhm.
They also have another way of alerting us with their cry, like, oh, this is not right, come on now. So if you're getting those from your baby, or if you are noticing that your nipples are hurting, so pain is an indication that something needs help.
Mhm.
So painful nipples, cracked nipples, that is not normal. A little tenderness at the beginning of feeds for the first couple of days is absolutely normal. It's like breaking in a new pair of shoes.
Mhm.
But if those new pair of shoes are leaving you blistered and cut, they're
They don't
not good for
feel
you.
right.
Yeah, they're like change something.
Yeah.
So this is the thing. It means that your baby is latching too shallowly, and
Mhm.
that will lead to not enough milk later because they're not getting the milk out that they would need to get if they were latched deeply. So
Mm.
addressing the latch, having someone that is professional look in their mouth and make sure that everything is functioning properly is really key. So pay attention and be gentle with yourself.
Mhm.
Those are the big things.
That's awesome. Well,
Yeah,
thank you so much.
it's a
This
pleasure meeting with
was
you.
really wonderful, and I'll let you get to your little guy. He was so patient. He
He
did so well.
was, he was. Thank you so much for your time. I appreciate you having me on
It was,
today.
it was great talking to you. Take care.
Take care.
Bye
Thanks.
bye.
Bye-bye.
And I'll just clip it right there so you'll
Okay,
be.
that's
Um,
good.
if you want to shoot me any of your,
Oh, yeah.
information, and if you have an image that you like, a picture of you that you'd like, I'll include it. And then obviously any of your online stuff, I mean, I'll be happy to
Absolutely.
direct people your way.
Yeah,
This is
some of
easy
it's
for online.
not great right now. I'm in the process of reshooting it, and as I reshoot, I plug it into the same URL so that it's
Yep.
really whoever's on next, they can see the most current version.
Yep.
Um,
Great.
so I'll send you all of that, and then I also have like in my classes, if they don't want to do the whole class, I have a really great latching video,
Uh-huh.
and I have a really great like just in the first 3 days. So even if you wanted to do like the full deal, and then if you don't have time for that, at least do this.
Yes.
That's what I tend to send to my families when I send them the link, and I say, if you don't have time for the 2-hour class, don't miss this, these 2 10-minute videos.
Mhm.
Um,
A lot of the women in Fit Me are pretty motivated
good.
to.
Okay.
They're gonna,
They'll
if
watch the
they're
whole thing. Okay.
wanting to breastfeed, they're gonna watch it because they're gonna be like, I want to know,
Oh,
how to
yeah.
do this. And
Yeah.
this is a source of stress for a lot of women. They have anxiety about it.
Yeah.
I'm in the process of trying to wean my daughter, and it is taking
It's tricky,
forever.
isn't it? What's working for you?
Well, fortunately, I've been blessed to be home with her, which I didn't have with my boys. And so I was able to not even need to pump. I just breastfed her for a year straight, and now we're at 14 months and I'm kind of ready, and
Yeah.
she's not. We're down to about one feeding a day where I feel like she's really truly nursing. But every time I try to like skip that feeding, she just it's really hard, and then I give in.
Yeah.
So she actually does fine with the go to bed, which is the one I know people usually have as the hold up. My husband can put her in bed.
Perfect.
So our normal once a day is in the morning. But if I'm gone or something and I think, okay, we've done it, and I come home, like maybe somebody's watching her, she's fine until I'm home, and then she's not fine anymore. So
Yeah.
maybe she's just not ready yet. I don't know.
Could be. Is it when you're in bed and she comes into you?
No, it's, and my husband is in the Navy, and so he was gone almost her whole first year. And so now he's home and she really enjoys him. But I really think she spent so much time with me. I think it's a closeness thing. I think
Yeah.
it's just she sees me, and the way that she wants to, be with me is nurse.
Yeah. Well, there are a couple of ways that I've seen it work really well for families. And I used one of these techniques with my little guy a while back, is to layer in another comforting tool.
Mhm.
So his was a nighttime feed that he didn't want to let go of. And so we used massage. So I'd give him a back rub. So it could be that you layer in a back rub on top of breastfeeding in the
Mhm.
mornings. So a
Okay.
nurse or counting, like the counting works really, really well if she is up for that. And you get, so it's the idea that you don't offer, but you don't refuse.
Mhm.
and then and not refusing, saying, sure, we can go ahead and breastfeed, but 10 only on this side today, or sure, you can breastfeed for 10 and 10, and then you count to 10, or you can count down and then blast off. That was what we used to do.
Oh.
10, 9, 8, 7, and then you blast off and then switch, and then 10, 9, 8. Okay, now let's go and do the puzzle that we were going to do this morning. So that it's not a hard no, because remember, it's not just, it's attachment too. And so it is important to have that touchstone, but layering something else in and kind of thinking about what is something else that would make her feel that way. Add it in, and then slowly back away from the nursing with the counting. And so you can do 10 and 10, and then you can do 5 and 5, and then it can just be gone.
Yeah, I will try that.
Let's do puzzle. Yeah.
I never had to do it with the boys because I worked out of the home. And so weaning was much easier because even though they were breastfed, they just weren't quite as attached. And so it was much easier.
Yeah. Yeah.
I will try it. I'll let you know how I do it.
The layering and counting technique worked very well for me, and it works. I've seen it work very well for other families too. There's also a really good book out through the Lactation League called How Weaning Happens. And that can be really helpful. So
I'll look it up. It's funny, you can be not a first-time mom and still not know how to do so.
Hey, this is why I do what I do. Like I am the breast whisperer.
Yeah. And
parenting related stuff. I mean, it's anything that's in that vein. So
yeah, and the last thing we want is breastfeeding to end traumatically when it's been such a positive, So
yeah. And some kids just do need it a little longer. And that, you've got to decide, because it's an agreement with your little person. And so it's sharing space. And some people struggle with that right from the beginning because pregnancy was hard, and maybe they have a background where they have been traumatized and they don't want to share space. And I think it's super okay to say that, that's okay too. Like, we'll bottle feed.
Yeah.
But what does work, and let's go in that direction. And so at the end, I think, just like, if you watch other species of mammals, what do the moms start to do? They start to like kick their babies away, or stand up, and they're all like falling off of them.
Well, the puppies fall off.
Yes. And we can relate with that feeling. I mean, we're not going to like bat our kids away, but redirecting them in the way that we know that we can. And respecting that it is okay to be done, because again, I mean, you hit the nail on the head. Like there's that we should. I should always say yes to breastfeeding. It's like emotionally feeding her. Well, there are other things that can emotionally feed her too if it's not working for you anymore. And that's why both the AAP and the WHO say until 1 year or until 2 years, as long as it's working for both, because no one should ever be made to do something with their body that they don't want to be doing.
Yeah. No, that's so helpful. I really appreciate the advice.
Of course. And it's also the first time you get to teach her about consent, which is powerful stuff.
Yeah.
So talking about asking and talking about you sharing your body. I think that we don't think of breastfeeding in terms of teaching body consent as much as we possibly could. It is. And we lay down those patterns that they will carry with them their whole life about being told to do something with your body. And so it's a great opportunity.
Wow. Yeah, I never thought of that, but it's so true. She's like taking, I'm like, wait a minute. This is mommy's chest. Yeah. Well, it was really great meeting with you. I'm sure